Well, good morning, everyone. My name is Warren Miller. I'm part of the team that is helping to support this meeting. Want to welcome everyone to the kickoff meeting for NC Transit Cares. I want to just go through a couple of technical orientation things for using the platform and how we're going to work together during the course of the meeting. So one thing as we get started, would like to ask everyone, if you can, to make sure that the name that is on your video screen matches up with, that we make sure we have everyone's full name and organization. So if you need to rename yourself, you can go to your screen and there are 3 dots in the upper right-hand corner. You can click those dots and you'll see a drop-down menu and an option to rename yourself. And so if you could, that'll help us make sure we get you in the right breakout, and if anything else that we need to make sure we can place you appropriately. So a couple of orientation points for everyone as we get started. We're going to be using Zoom. I imagine many of you have used Zoom before, so you'll see there's a bar at the bottom of your screen that has some of the different functionalities of it. We're going to ask everyone to go ahead and stay on mute because we have a large group. So you can go ahead and mute and unmute yourself there at the bottom. When we get to the breakout portion, you'll have an opportunity to unmute and we'll have some good discussion there. Make sure you turn your video on. It's really helpful to make sure that we can see everybody. If you need anything, we have technical support. You can go to the chat function and you can use the chat to find technical support, and that person can help answer any technical issues that you have. We're not going to be using the Q&A and chat as part of the meeting since we have a lot of people here. So we're going to ask that questions and comments are going to be primarily worked through during the breakout meetings. If for any reason you need to leave the meeting, you can do that by clicking the leave meeting bar as well. Again, if you have any questions, anything that you need in terms of making sure you know how to use Zoom, then you just go ahead and message the technical support person. Just a couple of meeting rules. We have this incredible opportunity here to have the entire state systems represented. So we want to take advantage of that. And so we know everyone here is a great multitasker. We want you to just practice those after this meeting. We're going to keep ourselves on mute. We recognize that meeting virtually isn't always the best way or ideal way, but we're going to embrace it. Eventually it will work. And again, if you need anything, just reach out to our tech support person. And we do encourage you to speak up when we are in the breakout groups. And that'll be an opportunity for us to really get in and have some good conversations. Want to let you know that we are going to take one break. So we really do want to encourage you to get up and stretch during that 5-minute break that we have. So just a couple of meeting rules. One other point is that we are going to use Poll Everywhere. We have a few polling questions for you. So if you have not logged in yet, we'd like you to go ahead and you can pick up your phone. That's really the easiest way to do it. And go to this login. It's pollev.com. You don't have to capitalize it. pollev.com/fountainworks. And that'll get you to the site where we're going to be running through some polling questions in just a moment. So I'd like to give you just a moment to go ahead to your phone, your browser. You can go ahead and log in. You do not need to submit your name. That's not important. So just take a moment. We'd like to get everyone logged into Poll Everywhere so that we can go ahead with a couple of our polling questions. So I'll pause for just a minute. Okay, so hopefully everyone has had a chance to log in. We'll go ahead and we'll ask our first question here. Which size best describes your system? Are you a rural system? Are you a small urban system? Are you an urban system? So we'd like to go ahead and get a sense of who is in our meeting today. Give you a moment, everyone. That should be popping up on your screen. And as you can see, the results are real time, and they get us a sense of who is in the room as we look across the state to all the systems that are here.
This is Carol. I'm having trouble.
So Carol, would love for you to just send a private chat message to tech support, and that person can make sure that you're all set. Okay?
Do that. I was trying to.
And just want to remind everyone that if it's possible, we can keep ourselves on mute again, just because we've got such a large number of people. So go ahead and do that if you're able to. I'm going to go ahead and move to the next question. So you can see here, we've got the majority of folks here are from rural systems, but we also have great representation from urban and small urban. So also want to get a sense of what part of the state are you from? So the way this works is you can just put your finger on where in the state you're checking in from. So let's just take a look at where we have folks from. So again, you can see we've got a really great representation from across the state, from the Outer Banks into the mountains and across the Piedmont Crescent here. So that gives you a sense of where everyone is checking in from. So with that, I would like to turn it over to Deputy Secretary Julie White for opening remarks. Thank you.
Hey, Warren, can you hear me?
We sure can. Thanks, Julie.
Great. Well, thank you, Warren. Thank you, everyone, for joining us this morning. I am very disappointed we aren't all together in person. We've been planning this effort for about 2 years now, and we had envisioned being in a room together and getting the great opportunity of the exchange of information when you could be face-to-face and in small groups. So certainly having to change up how we're doing things, and I think our team has done a great job of creating something really interactive and still having those breakout sessions and such with this technology. So I'm glad we could still proceed, and thank everybody for sticking with us through this type of format. On behalf of Governor Cooper and Secretary Boyette, I wanted to personally thank everybody for participating in today's kickoff meeting of NC Transit Cares Project. I wanted to thank you also for doing everything you all are doing as our state's so essential transit systems during this time of COVID. We know COVID has been relentless, and we know that you all have worked really hard and diligently on the fly to develop and implement some really innovative, creative, and unique processes to help keep your systems operational, your employees safe, and your patrons safe. And we know that COVID-19 there's no light at the end of the tunnel at the moment. It's having a really devastating effect on the transit industry, and it will challenge us to think about how do we remain resilient and viable and valuable to the residents that we serve. And that's really why we tweaked this effort when COVID hit to be focused on that. And so we have some very specific objectives for this effort in this time of COVID. First and foremost, we want to identify ideas, strategies, and products which help our transit systems respond to and deal with the immediate and long-term challenges of COVID. Second, we want to develop strategies and innovations which will help our transit systems become more resilient and prepared to handle future disruptions. And lastly, we want to build upon the North Carolina Public Transportation Strategic Plan by identifying new and innovative ways to improve access and opportunities for our residents, particularly those most impacted by COVID-19. I'm really hoping today's information exchange will prove valuable to everyone. We will have subsequent meetings, and from all of that, we will have what we will launch is a library of ideas and strategies and best practices, as well as actionable policy recommendations and projects. Again, I want to thank everyone for their participation, for hanging with us online. I know it can be tough for a long meeting, so we're going to do our best to keep you excited and engaged, and to know we're all in this together, and your involvement in this project is going to have an important impact on our state's future and the future of transit. I have the incredible pleasure and opportunity to introduce our next speaker, which is our FTA Region 4 Administrator, Dr. Yvette Taylor. She's going to provide us some remarks about the impact of COVID-19 on transit and the FTA's response. And we always appreciate her incredible partnership with us and her participation today.
Great. Good morning, everyone. And thank you, Ms. White. It's great to see you on the screen. Can you see me? Just going to check.
I cannot. Should I be able to?
I have my video off.
There you are. Okay, I just had to click over.
Okay, very good. All right, so good afternoon. Well, good morning still to everyone. I appreciate the opportunity to come and speak to hoping hundreds of grantees that are across the state of North Carolina. Like Julie White said, I regret that we're not there face-to-face. I do enjoy the opportunities of meeting with our grantees face-to-face and engaging in a dialogue. With that, let me jump into the topic that I've been asked to speak on. So I want to just say to the agencies out there, we know that you all have undergone tremendous challenges and sacrifices as a result of the COVID-19. And we on behalf of the administrator and the secretary of USDOT, we want to thank you and your frontline workers for all you are doing to keep America moving, and to let you know that the FTA continues to support public transit systems. Hopefully, many of you have already received your facial coverings that the FTA has sent out for the smaller rural and small urbans. Those facial coverings will probably be coming to you from the NCDOT. So thank you to our partners there at the state level. We want to just emphasize that safety of passengers and the transit workers is always our top priority. And so if there's more that we can do to help, we are here for you. As many of you already know, in March, the CARES Act passed, providing $25 billion to support transit operations, to support new safety measures, including more frequent cleaning, personal protective equipment for workers, and technology to support social distancing, such as contactless payment systems and protective barriers. For my region here, the Southeastern region, we received $2.6 billion of CARES Act funds, of which over $78 million has already been awarded across the state of North Carolina. So thank you very much for those grantees who have submitted those grant applications and have received over $78 million for the state of North Carolina. While we know the future of the industry will certainly be impacted by the current public health emergency, it also presents a huge opportunity for investment in technology and innovations in public transit. I want to share today with you that FTA has made significant investments in the advent of new apps for route planning and mobile fare payment that makes transit easier to use, more seamless, and even more important today, touchless. So across the nation, we are seeing systems increasing their use of technology. For example, right here in my region, Jacksonville Transportation Authority is using autonomous vehicles to transport test kits to the lab, keeping the entire trip contactless. In Dallas, DART has created an app that integrates transit across the region with one fare payment. Riders can take DART and Denton County Transportation Authority and Trinity Metro's Community Rail, their light rail bus on-demand personalized curb-to-curb services across Dallas-Fort Worth metro region using their Go Pass. Riders just tap the board, providing the touchless travel that we all need right now. In the Pacific Northwest, TriMet and Portland Streetcar in Portland and C-Tran in Vancouver have teamed up to create a mobile pass that riders can use to pay fares on any of the agency's rail or bus system. Again, using a card or a smartphone, just tapping to ride. Riders using the Hop Pass earn rewards toward future transit travel. So here are some examples of how transit systems are taking advantage of some innovation that is certainly serving us well, given the new environment that we're all living in. So while these apps were developed to make transit easier, it just really makes sense for a customer to use that one fare card to go from point A to point B. It's simply safer, and we all know that, to keep the same media to pay for everything across the platforms. So we have heard more efforts, we've heard about more efforts from transit agencies in the COVID era to explore new methods of fare payment, ways that are contactless. So what we're doing at FTA is supporting research into contactless technology. In March, as part of our Integrated Mobility Innovation Grant Awards, we invested more than $4 million to research contactless payment systems, an important operational change during this public health emergency. Now we will be looking at expanding the field of available innovations to improve the safety of riders, the safety of the operators, and maintenance personnel. And I believe we will definitely see new opportunities for technology to improve safety in the wake of the current public health emergency. Since January, FTA has released 5 notices of funding opportunity. I know we always like to talk about money, and this has totaled more than $41 million, which has addressed new mobility models, accelerating innovation, improving safety through research, enhancing bus compartments for operators, and promoting better asset management. We also added COVID-related activities to our research programs. So for example, our bus compartment redesign program includes elements to provide operators better insulation and protection. In March, we also announced selections for 25 projects under the Integrated Mobility Innovation Program. And this is for grantees who are researching new mobility models, transit automation, and multimodal payment. Also, FTA is providing $11 million under the Accelerated Innovative Mobility Program. And this is to help transit agencies explore new financing, new designs, and service models. We're investing $7.3 million in safety research and demonstration programs and $2 million in bus compartment redesign grants. We're also in the process of evaluating our future research, and we'll coordinate with our partners at the Transportation Research Board and APTA, especially on research related to pandemic preparedness, response, and recovery. So we look forward to continuing to do our part as your federal partner and working with North Carolina in any way that we can to continue to support safe transit for the riders and for your operators. We want to be there for you. We've continued to try to relax some of the regulatory requirements going forward in this pandemic environment. And we will continue to provide our discretionary programs that you all can be able to come in and compete for. So again, while this is unprecedented times that we're living in, it can also be opportunities for us to continue to improve on our transit systems. And again, the FTA is proud to be a partner with the state of North Carolina. With that, I want to thank you again for inviting the FTA to be a part of this forum. And if there's an opportunity for any questions, I'm not sure how we want to handle that, but I'm open to taking any questions. Thank you.
Thank you, Dr. Taylor. We very much appreciate that. I was taking copious notes. I appreciate the review of the grant opportunities that you all have been doing. We have been following those very closely. And I'm making some notes about some of the ones that I want to go back and think about with this team that maybe we can go for in the next round in terms of innovation and contactless transit. So we appreciate your efforts in that area, as well as your efforts in the autonomous and moving of supplies. These are all, it's great to hear the FTA is on the cutting edge in all of these areas. And we do appreciate the masks for we received them in our offices, and then we did a survey to see who needed them so we could target them out. So folks who responded to that will be getting them shortly. So thank you for the sharing of those as well.
Excellent.
Warren, do I turn it back over to you, Warren?
Yep, I'm gonna turn it over to Jim Westmoreland.
Good morning, everybody. Jim Westmoreland here. Thank you again for the opportunity to be involved with the project team and the NCDOT. I wanted to thank Dr. Taylor and Julie for their good support and leadership for this project. It's interesting to me as I was listening to Dr. Taylor about all the different things that are going on nationally and internationally right now with COVID. And as Julie mentioned, I too want to echo my appreciation and support for your leadership as you've had to deal with COVID and sort of an unusual set of circumstances. So what I want to cover, next slide please. What I want to cover this morning is to spend a little bit of time talking about the project purpose and how it developed, the approach, the timeline, and other details associated with it. So suffice it to say, COVID's had an impact on all of us. I know that when we looked at some of the initial survey results that Morven will cover here in a minute, it was pretty clear to see that ridership levels were down, revenues are down. Safety protocols have been implemented by all systems that are now requiring both time and attention that weren't there before. The long-term impacts and travel trends of COVID are going to be with us, I think, for a while. Certainly travel patterns have changed over the course of the past many months. Social distancing, masks are now requirements of all systems, and I think create some very unusual circumstances and problems for systems that they're currently dealing with. And certainly as you think about increases in ridership and demand in the future, how you're going to handle that. Innovation and technology deployment certainly are needed. It's interesting when you look through the survey results again and some of the things that are happening both in North Carolina and domestically with systems and what they're being required to do right now, how much innovation and technology are really driving things that are happening. And certainly, as Julie mentioned, I think one of the primary focuses of this exercise is to hear from you and get your ideas about things that you're doing so you can share that with others. Dr. Taylor mentioned some things that are happening across the U.S. related to other systems, and I think we can learn a lot from those things such as cashless operations, some new routing scheduling software packages that are being implemented across the country. And then, as Julie mentioned, new partnerships. We're all in this together. It's going to take a collective of everybody working together to solve the problem and make transit more efficient and effective going forward. Next slide, please. So the project approach, again, through meetings like this and through follow-up surveys and work with each one of you, we're hopeful, again, that this will be a forum where you can share your ideas and your best practices with your colleagues. I think there was a theme in the responses that really talked about how much value and how much support that you felt both from the Department of Transportation as well as your colleagues in this unusual environment, and we hope to be able to capture those good ideas in this exercise as well. Some of the things that are out there in terms of solutions going forward, certainly we all want to do our best work related to customer safety and service. I will say that certainly employee safety and employee operations or transit system operations are another area of focus with this because we all know that that's been impacted as well. And then really how do we define sort of NCDOT's best role and opportunity to help with innovation deployment going forward? As we get into our conversation today, we'll all be focused in breakout groups, and that's where hopefully both existing ideas and new ideas will come to the forefront. Julie's really expressed, and Heather Hildebrand and Ryan Bromfield, who are working with us on this as well, have expressed a real interest in identifying ideas that might be applicable to all systems and certain types to help with supporting the implementation of that, whether that be through technical support or whether that be through the possible implementation of pilot projects. And last but not least, with the project approach, it's not listed here, but we have formed an initiative development committee and have a list of members from across the state that are involved in helping to provide oversight to the project with various transit systems. That's extremely helpful and important. Next slide, please. So what are the goals for the project? Well, really to help identify, I will say, solutions more so than products, which will help each one of you deal with both the near-term, long-term impacts of COVID-19, the response. Certainly know that there are many issues that you're facing, and there's many opportunities for looking at solutions, and also know that there's a lot of ideas that have already been developed that can be captured in this process. Really want to focus on those strategies and innovations that can help, as Julie said, help you become more resilient and prepared to handle future disruptions. I wish that today was the day we all could declare that COVID was over and life was going back to the way it was before COVID. But unfortunately, that's not the fact. We all know that we're in this for the long haul. We all know that there's continued issues that are developing each day in your local systems. And then finally, we want to demonstrate how this connects in with the 2018 Public Transportation Strategic Plan that many, if not all of you, are involved in developing. And as I look back to the plan, there's sort of three key focus areas of that 2018 strategic plan that really apply to the work that we're doing here today. One focus area was on the focus of exploration of technology and innovation to enhance transit efficiency and effectiveness. I think we all can understand that the more that we focus on how we use these different strategies and different technologies will help us through this process. There was another focus area on the need for connected transit system networks and support infrastructure. I think there were ideas presented in the survey that Morgan will cover that clearly show that there are connections to be made between systems to help us all be more efficient and effective going forward. And then last but not least, a focus area on need for enhanced partnerships in terms of things that we can do together to help each other in our support. In addition to the 2018 Public Transportation Strategic Plan, this effort also builds upon things that have been developed with NC Moves 2050. Certainly I know with the last Transportation Summit that was held back in 2019, there was a lot of focus on innovation and technology as well. Next slide. So there's 4 outcomes and deliverables for this effort. First and foremost, we want to use this as a very engaging, rich opportunity for each one of you to share your ideas and best practices with each other. I think there's a lot of value with us all coming together and talking about these issues and how we can take what's already been developed in the way of good ideas with other systems and make it transferable to others. The second thing is we hope to develop more of a statewide repository for this body of work, as well as things that are happening with COVID-19. I did want to thank and recognize David Rue with NCPTA and those members involved with NCPTA that have been helpful in sharing information via their listserv, and certainly David and NCPTA for stepping up and being a partner with us in this body of work. Also want to be able to capture what we have identified in the way of survey responses and other information that we'll receive from you. And then last but certainly not least, focus on these new and different ideas and innovations that may help us all be able to better respond to COVID-19 going forward or other things that may happen in a similar way. Next slide. So the project schedule, we're here today, July the 22nd, kicking this off. Certainly, as Julie and Dr. Taylor have mentioned, I too am a people person. I love to be able to see and touch and understand what's going on and read how people are responding to certain things. But we're at where we're at, and we believe that likely between now and certainly the next meeting, we'll have to continue to do things virtually. So we have the kickoff meeting today. We've got another meeting scheduled for September the 9th from 9 a.m. to 11. If you go ahead and mark that on your calendar, that will be another Zoom meeting. And then finally, we're hopeful, even though we don't have clearance or sort of a perspective yet, to have an in-person meeting when we actually, as we're calling it, launch the work that we're developing here over the course of the next couple of months, to be able to share with both the state and other state leadership at a higher level and get more of a focus on implementation. There will be follow-up activities of things that we'll ask you to do as we get into this work in terms of helping us to better identify some of the existing innovations and best practices that you already have going on, more information about new ideas that are out there. Part of what we're going to do as a team is to research the ideas that are presented by the systems and come back at the next meeting with more embellished sort of perspective on those ideas, so the systems can help rank those ideas and identify sort of a top 3 set of priorities by system type with each one of our efforts going forward. Again, we're hopeful that we can do our Launch It meeting in person, and we'll just have to stay tuned for that. So at this point in time, next slide, please. I'd like to introduce John Gasparine. And John, are you on the call now?
I am.
Okay, so let me quickly read John's bio for you. So John is with WSP USA Incorporated. He has over 19 years of multidisciplinary experience in the field of public health and transit. John entered the workforce with a degree in biology, was a licensed registered environmental health specialist in the state of New Jersey, and he's worked for several years both in the field of public health and epidemiology. 10 years ago, he entered the transit industry and is going to lead the transit policy, planning, operations, and program management initiatives across the country for WSP. He was the lead author for APTA COVID-19 Guide, the New York MTA Global Best Practice Report, and is presently helping multiple transit agencies with various aspects of pandemic response and reopening plans. So it's my pleasure to introduce John to you today. John's going to cover sort of some national and global perspectives of things that are going out there with COVID-19 response, and hopefully to generate some ideas in your head and some thinking as we get ready to move towards our breakout group. So John, welcome.
Thank you, Jim. Next slide, please. So just brief agenda for my segment, cover a little about what's going on in the US, maybe some different perspectives than you've seen earlier in today's presentation. I'm going to go through also basically some resources that are available to you, what's on the next frontier for pandemic safety, and then also leave you with some thoughts that you might consider as you look to continue strengthening your toolkit to fight the spread of COVID-19. So next slide, please. So we're all acutely aware already of the fiscal and ridership impacts of this disease. You know, what's particularly difficult right now still is that, you know, the world's leading scientists are still learning every day new things about SARS-CoV-2 and COVID-19, and that means that those leading transit agencies all the way down to frontline staff, everybody is required to learn while at the same time react, and that's a very difficult position to be in. And you know, to state the obvious, I think we're all aware how critical transit is through this pandemic to help rebuild our economy, but more importantly, to get us out of the pandemic. We know that we have dependent riders that depend on transit to get to their job at the hospital or pharmacy, and then we have citizens that depend on it to get to food and to get to the doctor's appointment. You know, I don't want to start off on like a doom and gloom note, but you know, there's been thousands of people that are employed by transit agencies across the U.S. that have gotten sick, and there are many that have unfortunately died. And so the vigilance that we need to have, no matter what state we live in, no matter what the curve looks like right now, the vigilance needs to still be up. And so next slide, please. Couple resources that I want to point out to you. One is the APTA COVID-19 guide, which Jim mentioned. Many of you may already have seen it. It was published on April 13th. We developed it in collaboration with faculty from Hopkins, and it distills CDC guidance into transit language. One thing that you can look forward to is we're wrapping up right now an update to this guide. There's been a whole host of new scientific study and public health guidance that has come out since April that's very relevant to transit agencies. And so we're incorporating all of that into additional guidance. And hopefully you'll see a new version of this guide on APTA's website around the end of this month. Next slide, please. So normally we wouldn't share a document that we produced for a single transit agency, but in this particular case, New York MTA posted this report to their public website. If you go to New York MTA's COVID page, You could scroll down to the bottom and you'll see WSP report on global practices. They wanted to make this report available to the state transit stakeholders around New York, but also make it available to other transit agencies. This book does not have recommendations in it. The APTA guide does. This book instead looks at what other organizations around the world have been doing up through the middle of June to help protect human health. We looked at over 30 countries. We put together over 120 case studies. To be clear, again, this is not a book of recommendations. These are a book of considerations. There are a number of things in this book that we probably should never do in the US, but we've still documented where they're being done overseas. And there's a number of other things that you can consider to help strengthen your pandemic resiliency toolkit. Now, I would encourage you to consider partnering with your local public health officials to consider which things out of the New York Global Practice Report and even which things out of the APTA guide you might consider for your agency. You know, another one of the challenging things about this pandemic is we're all dealing with a medical issue, right? But the people that run the transit agencies are typically not trained formally in medicine. And the deep partnership with your local health officials can help supplement that deficiency. And they can help you make better decisions about which practices you adopt, how you prioritize them, and so on and so forth. So we can go to the next slide. That's actually a good segue. I want to talk a little bit about what I see as the next frontier in pandemic safety. The first item on this slide is increasing access to credible scientific advice. There's no limit to the amount of partnering you can do with your local health officials. The best example that I've seen thus far, there's a small bus agency out in California. And after they started having incidents of disease in their agency, they got a local health official to come out for 3 weeks onto their property. That local health official spent those 3 weeks helping them develop policies, procedures. The health official even helped do the hands-on training with the employees to help ensure the safety of the employees and riders. That's deep, right? Now, some health agencies will not have the bandwidth to provide that level of support. And if your local health agency doesn't, you know, we're going to talk about some things on the next slide that you can consider to address that. Also consider partnerships with academia. There are medically and public health trained experts in your local universities that might also be able to give you advice. And if you're an agency that does have some money that you're interested in investing in research, you can help fund research within your given agency on a given topic, such as indoor air management. That's a good segue. I want to talk a little bit about engineering controls, and that phrase falls in the context of the graphic on the right. The hierarchy of controls, which you see on the screen, is basically used across all areas of science to consider the interventions that one can take to mitigate a hazard. And some people misinterpret this diagram. They interpret PPE to be the least important. This graphic doesn't say what's most important or least important. This graphic says what's the most effective. PPE is very necessary. It's just you shouldn't depend on PPE alone. That's what this graphic is saying. In this particular health emergency, COVID-19, we don't have the option of implementing controls in the blue and green regions. We only have options to implement right now in the yellow, orange, and red. And if you look at what we've done in our industry thus far, it's mostly in the orange and red. And that leaves that yellow band, engineering controls, as the area where we can have the most innovation. I've listed some areas where innovation is on the cusp of occurring. And it is very relevant to what we do in transit. The first is in indoor air management. This is recognizing that the easiest way to get sick is to have an infectious respiratory droplet land in your eyes, nose, mouth, or inhale it into your lungs. And we know that physical distancing and mask usage helps protect against that. But the CDC and all health officials across the world agree that part of that toolkit is improved indoor air management as well, specifically increased outdoor air ventilation. And there's much more that can be done in terms of research and innovation for figuring out how we can further strengthen indoor air management as part of the toolkit. In busy transit agencies where crowding might still be a concern in vehicles or facilities, agencies are beginning to explore how we can do real-time monitoring of vehicle or station capacity, so that we can provide that information to the customer and they know which vehicle is going to afford them the most physical distancing. Another innovation that's on the cusp is low-cost instant viral test results. There are multiple products that are in the final phases of clinical study that are similar form factor to a pregnancy test, where you don't need a medical professional to administer it. 15 minutes, you have a result, and the availability of tests like that could make a huge difference in breaking the chain of person-to-person infection, because it lets you diagnose the issue faster, as opposed to now when you wait 5 to 10 days for your test results. And then the last item, which I could probably talk about for 30 minutes solid, is contact tracing. I think we all know what that is, right? It's when a trained person identifies who a COVID positive person has been in contact with, and then you talk to those people that have been in contact and you persuade them to isolate. Well, that process is slow. And until the contact tracer can get to those contacts and effectively persuade them, those contacts are at high risk of continuing to spread the disease in the community. There are a lot of things that we can do in a transit agency in terms of policy and process to increase the speed that the health department can do their contact tracing. And positive health outcomes in our communities means positive health outcomes for our industry and for our workers. Next slide. This last slide here is some practical thoughts to leave you with that you can consider for your transit agencies. The first bullet here is demand support from local health officials. Demand it. I've gave you the example earlier of the California agency that got really deep support from their local health officials. And if you can't get that, then there is still easy ways to extract value from a relationship with them. One of the easiest ways is to submit very discreet questions in writing to your health officials and ask for discreet answers back. You'll see examples of this in the APTA guide. There's the whole section from Hopkins in the APTA guide is question, answer, question, answer. You can phrase a question like, we have paratransit operators that are required to be in physical contact with the customer. Should they just be wearing a cloth mask and using hand sanitizer, or should they have more protection? That's a question that you can phrase to your local health official, and that gives them enough to answer back. Bear in mind that your local health officials, they're not transit experts. So your question needs to be phrased in a way that describes the challenge as well as the point of your question. But this is an easy way to be time effective with your health officials in getting advice. Next, I'd like you to consider placing emphasis on the primary route of disease transmission in all that you do. We know that it's easier to get sick by having a respiratory droplet from an infected person land in the mucous membranes or go into the lungs of another person. Cleaning and disinfecting does not disrupt that chain of infection. It does not disrupt that pathway of infection. Yet what I tend to see is a lot of transit agencies, they're putting all their emphasis on cleaning and disinfection. I don't think that we should do less cleaning and disinfection. I don't think we should communicate less on cleaning disinfection. But what I do suggest is that we build our emphasis around the controls that will disrupt the primary route of transmission. That we put our emphasis around the physical distancing, the mask usage, and the indoor air management. And this is a good segue too into my last bullet. we're all good at promoting mask usage within our transit organizations, right? But the way we generally communicate the need for a mask is we say, wear a mask, you know? And there are people that don't want to wear a mask. And there are people that are not wearing the mask proper. And those people increase the risk of COVID spreading. I think there's an opportunity for us to rethink how we communicate some of these things, where we can become more persuasive, when we can start to understand who are the types of people that are not wearing a mask, who are the types of people that aren't wearing it properly, why might they not be wearing it properly, why might they not be wearing it, how can we approach them in an empathetic and respectful way and persuade them to want to wear it, how can we persuade them to want to do the physical distancing, right? There's ways we can consider evolving our training and communications to have different outcomes. And the CDC, I risk saying this in this audience, you know, they probably could have done a lot better in the way they've communicated some stuff themselves, but they still have a really good resource on their website that if you look at the fundamentals of their CERC manual, CERC, when you go to their website, if you take some time to read that, it really thoughtfully talks through this idea of persuasion for better health outcomes, the psychology of better health outcomes through better communications. And I encourage you to look that up and to consider it. These four things to me on the slide build on what you're probably already doing. And you can consider if you can take some of these ideas today without any additional need for purchasing of things and see if they might help influence how you can strengthen your resiliency toolkit. So that's my presentation for today. If you guys do have any follow-up questions, I'm sure you can ask them through the conference organizers. And at this stage, I'll turn it over to Morven McLean. Morven is a transit project manager in our Raleigh office, and she'll take us through the results of the online survey held prior to this meeting.
Great, thank you, John. That was hugely informative, so appreciate all of that information that you shared with us. Warren, I'm going to do a quick audio check. Everyone hearing me okay?
Yes.
Great. So we sent out a survey before this meeting to learn from all of you about the impacts to your agencies of the COVID-19 crisis. We wanted to really hear and understand from you the short and the long-term impacts that you've been facing, and begin to study innovations that you have come up with in this initial phase of the COVID pandemic. And then, as Jim mentioned, we've got 2 remaining meetings under this initiative, and our goal is to really dig into the best practices and innovations that we're hearing about to help transit stay strong in North Carolina. So 48 agencies participated. Thank you for all that joined in. We asked you 10 questions. So let's take a look at what we heard from you all. So next slide, please, Warren. Great. So the first question we asked, what have been the immediate impacts of COVID on your operations? And unsurprisingly, as we were in phase 1 of Governor Cooper's stay-at-home order in March and April, decreased ridership was the #1 impact that you faced. So with that reduction of riders and of course accompanying increased revenue, we also heard from you the need for more buses and challenges spacing out riders on vehicles to meet social distancing requirements. Many drivers were furloughed and others resigned due to health concerns, and there's uncertainty about how many of those drivers will come back. One of you noted, I think stated it well, you said there was an overall sense of fear and anxiety among both our staff and our community. So next slide, please. Then we asked you to anticipate what long-term changes do you expect as a result of COVID? And the biggest response here was that you anticipate this continued reduction in ridership long-term. Many of the community systems expressed that the elderly populations, they believe, will continue to elect telemedicine appointments, So you'll be avoiding community centers, senior centers, and that will impact your ridership. One of you said enhanced cleaning is here to stay. Social distancing requirements will continue, we believe, at least until a vaccine is developed and distributed. So as one agency said, we are using twice the vehicles to transport 1/4 of passengers. Others of you said it's still a little early to really know or anticipate long-term impacts, but imagined some possible long-term changes. A couple of you noted that maybe staying fare-free would have to be considered, and others noted you'll have to revise your route planning. So some of the routes that are now deviated fixed might have to be reimagined to avoid having passengers on buses for longer durations. Next slide. Next, we asked, what changes have you implemented in response to COVID so far? And you can see by the chart, the largest response here was health checks for drivers, providing protective equipment to your drivers, getting barriers between the operators and the passengers. And some of you were able to get plexiglass shields installed, and others of you were innovative and you got clear plastic shower curtains and installed those between the driver and the passengers to give the barrier that the CDC recommends. Some of you have trained drivers to assist ambulance drivers if needed, and one agency has reassigned a vehicle to the County Emergency Management Department to transport COVID patients as needed. Increased sanitation, cleaning, we heard is throughout the responses. And one respondent said the focus has shifted from providing the most efficient service to how can we provide the safest service. Another significant change has been that systems are not transporting people with COVID symptoms or those waiting on a COVID test result. Next slide. So next we asked, what changes do you think will need to be implemented to account for COVID-19 and to continue to ensure services meet the need of your passengers? And the majority of the responses to this question said that funding innovations will be needed, and noted that help with operating funding is really critical. Some other suggestions here included, some of you asked that drivers who are responsible for cleaning, can there be a training and possibly even a certification class for all operators that are required to clean their buses so that they know that they're doing it correctly and in accordance with CDC guidelines? PPE and getting PPE, we heard in your responses, has been important and sometimes challenging. So some of you asked if face masks and goggles and thermometers can be made available under the state contract. Others of you imagined that as ridership comes back, you may have to add vehicles as the riders start to use transit again, but still we're under this requirement to maintain social distancing. And here also many of you noted that more regional coordination on rides and systems working together and cross-county ride sharing is really an area that needs to be explored. Next slide. So next we asked 2 questions on innovations. And the first part of these questions was, what have you done that you consider innovative in response to COVID? And here we heard one agency who established a dedicated COVID-19 phone line to handle the overwhelming calls from concerned riders. One of you partnered with a local company who mostly works for NASCAR, but got them to make safety shields for transit vehicles to protect drivers. We heard that 2 of the systems partnered with senior citizens nutrition programs. So meals which would normally have been delivered to a congregate meal site now needed to get out to elderly residents that were sheltering in place. And 2 of you figured out how to help with this. This was a new concept, and you noted that reimbursement from senior center funds helped with budget challenges. Others of you figured out how to use the right match reminder calls and really add on local public health information to those reminders and remind riders to wear masks always on transit. And this is where we heard in the responses that the NCPTA listserv was noted to be a wonderful resource in sharing innovative ideas and learning from other systems. Next slide. So we also asked, what have you heard other agencies doing that you would like to learn more about? And the number one answers here were around PPE, again, how to get it, what to procure. Any innovations around sanitizing procedures and technologies were noted as being desirable. And also many of you are interested in getting away from drivers handling cash in this current environment. So what are the innovations around contactless fare payment? Next slide. So now it's almost hard to imagine pre-COVID times, at least for me it is, it seems so far ago, but we asked you, what were you doing that was innovative prior to the COVID outbreak in March? And here we heard some of you looking into pilot projects around micromobility, microtransit. Some of you are getting into mobile ticketing together with other regional partners. And one of you is working with NextBus to assist with Where is My Bus technology for riders. Next slide. Generally, we want to know what innovations you're interested in, because this will be a building block for our later work as we work through this innovations project. So we heard here that you're interested in new passenger information systems, both on board the vehicles and at bus stops. Again, anything around how to clean and any technologies that would help you keep the buses clean. And then one of you noted that any innovation or technology that allows us to connect underserved communities more would be helpful. And this is felt to be even more important in the pandemic, to really connect to underserved and transit-dependent communities. Also, scheduling with a 6-foot distancing requirement between passengers is obviously complicated. So any innovations or technology, any software that can help with that was noted to be of interest by you. Next slide. So then we asked, what should NCDOT's role be in deployment of innovations? And a second part of this question was, should this role be different in response to COVID-19? And the top response here was that NCDOT should provide guidance and generate ideas for agencies system-wide. NCDOT's role to fund innovations was noted to be important, perhaps providing seed money for pilot projects, and also providing some help, some guidance on how to decipher state and federal rules that may apply to any new innovative approaches or projects. You asked that there be sharing of ideas between systems, take the lead role and offer statewide contracts for items such as on-demand software and driver protection shields. And the answer to the second part of that question, should the role be different in response to COVID, was mostly yes. And as one system said, this is uncharted territory. We need guidance to sustain our systems and stay in compliance with state and federal guidelines. So with that, that concludes the review of the survey findings. And Warren, I will pass it back to you.
Great. Thank you, Morven. So at this time, we are going to give you a break. We're going to take a 10-minute break in the program. And we'd like to just encourage you to get up and stretch. I'm going to put a timer up on the screen so you can see how much time that we have left. And when we come back, we're going to give you a chance to get into breakouts and really start to talk about some of your ideas and what you want to learn more about. So with that, we will take a 10-minute intermission, a break, and we will see everyone shortly. So welcome back, everyone. We're going to reconvene, and at this time, give you a moment to go ahead and get set back up. Would like to take this opportunity to welcome and recognize NCDOT Deputy Secretary David Howard. So with that, I would like to welcome Deputy Secretary Howard. Thank you. We cannot hear you. You are on mute. Okay.
David's just saying that he's glad to be here. He thanks everybody for their participation in the effort today. And if he could see you in person, he'd give you a big old hug. Thank you for being here, David. Appreciate it, man.
Hello.
So we're gonna, if
is that better?
That's great. Thank you.
So you can hear me now?
Yes.
Okay, so it must have been my headphones. I'll take those off. How's everybody doing? Get all 100 of you to say hello at the same time. All right, so I'm on my iPad, so we're going to try to make this work real quick. I just wanted to join you real quick to say I appreciate you taking the time to be involved in this process. This was a brainchild of Deputy Secretary, I was going to give you a promotion, Deputy Secretary Julie White, working with our good friend, former Secretary Westmoreland, kind of figure out how to pull the transit systems into this conversation about innovation. Of course, COVID came in the middle of all that, and we pivoted now, and we're talking about innovation in a time of COVID. And I think, talking to Julie, I think you could make the argument that because of COVID, innovation will be the way forward. It'll be the new norm for transit systems. So I implore you all to really jump into this process and be as involved as possible so that we can come out of this. It occurred to me when I was sitting here thinking about what to say is, there's probably not a time in my history or my lifetime where transit has been more important to the process. If you think about the economy and people's job situations as they start to kind of re-enter into this economy and figure out what our new normal is, people are going to be dealing with money in a different way. So it'll put pressures on the systems to make sure that we're moving people around to opportunities as best as we can. In fact, I was just talking to Jamal Alide with our transportation planning area the other day, and he's been sharing what our vehicle miles traveled are in the state and kind of how we're coming back on. And one of the things that was kind of shocking to me is that we're actually seeing a higher uptick in the movement in the rural areas of North Carolina than the urban areas, which I thought would have been the opposite. And I think that just reminded me that so many people in rural North Carolina are dependent on being able to move around to get to whatever they need. So it puts pressure maybe on the transit systems in our rural areas to be part of those solutions. Because the people that do have options can move around. The people who don't have as many options are going to be more dependent on U-Haul systems than they probably ever have been before. And that kind of leads me to the other thing I wanted to just talk about real quickly. About a month ago, it seems like in addition to 4 months ago, the world turned upside down, and then another month and a half ago, it turned upside down again with the death of George Floyd in Minneapolis. And this whole conversation about equity. I've actually been pushing my teams, because if you know what I'm responsible for, kind of almost everything except highways, you know, a lot of those areas are the ones that deal with the equity issues of transportation directly, whether it be transit, whether it be ferries, rail, whether it be the Office of Civil Rights, it'd be our HBCU outreach office. A lot of those deal directly with the people that are affected by these equity questions. So I've actually pushed my teams to start a conversation about what they can do in their offices with their teams to deal with equity. And I would implore you, while you're thinking about kind of innovation and what you do with transit services moving forward, that you think about your space in that as well. Because you probably don't call it a program, but you do more with it. Julie, I can't remember what Jason told us, but I think 60% of the people that used our inner city trains are minority. I would bet you if I asked each one of you guys about your systems, a large majority of yours would be minority as well. I mean, they're really dependent on your services to better their lives, whether it is connecting them to education, to jobs, to healthcare, to, you know, just their life. There's a lot of kind of the work that I've done. You know, when I was at Federal Highways, I was part of what Secretary Fox talked about, the lattice of opportunity. You know, and a lot of that was pushing the national conversation. So my goal now is to bring that back to North Carolina in a way that maybe I haven't over the last 3.5 years of my tenure here, to really push that conversation here towards the end of this first term, to really see if we can leave a roadmap for the future of how people can be involved in this conversation about equity. In fact, we've started something called Sea Change, and that is SEA change, and that stands for Strategic Equity Assessments. If you're interested in kind of what we're doing, you can let Heather and her team know. We'll be happy to share kind of the ideas we've come up with. But I think it would be important for all of us to do kind of a C assessment, if you will, or a strategic equity assessment of where we are as a system, and then as where we are as a state. So with that, Jim, I'll turn it back over to you. Julie, thank you for your leadership on this. And I look forward to seeing what comes out of this process. But thank you for just giving me a few minutes just to say hello and to kind of charge you with maybe yet another thing to do, which is to look at equity while you're doing all this. So Julie, you got anything before? Did I miss anything?
No, thank you very much for joining the call, David. We appreciate it, and we appreciate your focus on transit and its role that it can play in social equity. And we'll be happy to bring some of that forward in a future meeting.
So I've actually bothered you guys for like 5 minutes already, but I'm gonna tell you, the folks that have heard me talk before, because my mother was a single mother, I started using transit when I was 6 to go to school. And I use transit still to this day whenever I travel, just because it makes the most sense. I've gone to Beijing and used the transit system. That's my challenge. If I can use a system in any city, then I know that I'm still connected. So there are a lot of people depending on you guys to get it right, a lot. So have a good meeting. Thank you.
Warren?
Okay. Thank you, Deputy Secretary Howard. We appreciate that. We're going to go ahead and share my screen, and would like to go ahead and get us ready for our breakout sessions here. As we think about what we want to do, we have a question for you, and the question that is up on the poll everywhere, and we'd love for you to just take a minute and add to this. What does innovation mean to you? So when we talk about innovation, what does it mean to you? Take a moment. You're going to be using your poll everywhere that you used at the beginning of the meeting. Would love to have any additional impressions or thoughts. What does innovation mean to you as we start to think about our breakout sessions, what we're doing, what we want to learn about? Take a moment. You can enter a word or a phrase, and we'd like to go ahead and get this up. So as this continues to evolve here, really like some of the themes that are coming out, that you can see things that are new, thinking creatively, ideas, modern, response, agility, There's a lot of things that as you think about it, really help define what it means to you. Let's just take just another minute. And part of what we'll do at the end of this presentation, we'll send you the link to the recording, the slides, as well as the outputs that come out of the breakout sessions and these polls. So we'll have this to you in a different format as well. So at this point, what I'd like to do is to go ahead and get us ready for the breakout sessions. What we want you to do is we want you to think about innovation in terms of things that could be incremental improvements, as well as things that could be breakthrough. We invite you to explore both ideas in your breakouts. When we think about innovation, it can be a small incremental, the idea of installing shower curtains when plexiglass dividers are not available. It could be really rethinking about the air in your, the indoor air, and how can you treat that as a way to reduce the virus. So we'd like you to think about both the small and the large as you think about what you want to learn about. So I'm going to give you instructions, and then we're going to put you out in breakout groups, and you're going to be broken out by system type. So you're going to be with folks from around the state that are of a similar size as you. The three questions that we have for you in our breakouts: what are the biggest challenges you face? What are you currently doing that is innovative? And what innovations would you like to learn about? And we'll repeat these questions for you when we get into the breakouts. We're going to put you into the breakouts. You'll have about 30 minutes. We're going to capture those outputs, and then we'll be able to hear a little bit more about what came out. So with that, I'd like to turn it over to our team. We're going to take just a moment to put you into breakouts, and we will see you all back in about 30 minutes. Okay, welcome back, everybody. Really appreciate you taking the opportunity to share this input during the breakout groups. I can already see from the Google Slides that we've had a lot of discussion, a lot of great feedback. So we want to take just a moment to hear from the facilitators in each group. We're going to ask you to just take about 1 minute, give us the highlights, and I want you to focus on what are the innovations that you want to learn about. So we asked about challenges, we asked about what you're currently doing. Where we want you to focus your debrief on is what are the innovations that your breakout team was really interested in learning about. So would like to start with Jim Westmoreland's group.
Sure, thank you all very much. So the primary things that we hit on, and they're captured in these different tab notes, include really a focus on how do we get people to feel safe again about using transit. And there was a suggestion in our group about reviewing some of the practices of the airline industry, rail industry, et cetera, about things that they're doing to make people feel safe, both from a technical standpoint as well as from a marketing and public relations standpoint. We also had an idea presented about accreditation for cleaning and how that may make people feel safer and how it may better inform and educate some of our drivers and other transit users in that accreditation process. We talked about sort of the element of card or touchless types of systems. I know that we had a couple of representatives in our group that already had a similar kind of Parapass system that they were using in their areas, and people were becoming more acclimated to that touchless fare system. We talked about UVC kinds of cleaning operations in terms of ultraviolet devices and what that might mean relative to technologies that are out there to help with cleaning efficiencies. And then we talked about the whole challenge of social distancing and how that relates to demands from passengers and vehicle fleets and software applications that might be out there to be used to be more effective in terms of things that are needed to respond to those social distancing requirements. So that was the focus of the discussion of our group. A lot of good ideas about things that were desired to look into, as well as existing practices that we'll document. So thank you.
Great, thanks, Jim. And we're going to work our way through each of the 7 groups. And what I'd like to do now is ask Rachel if you can go ahead and share a little bit more about what your group was interested in learning about.
Yeah, thanks, Warren. So we kind of started off with some technologies. One innovation we thought about was maybe an app or a tool that would allow feedback from customers, whether or not they feel safe, how do they feel about using transit, ways to get kind of real-time feedback from customers. Another one is kind of the real-time bus app that Morven had mentioned during the survey. So again, where's my bus located? And then also accessible cashless payment options. So making sure that those payment options are accessible for all users. That was an important point to that innovation. And thinking about kind of the vehicle space, going off of some of the points Jim had mentioned, we talked about cabin air filtration. So again, also thinking about, the vehicle similar to an airplane, how do you filter that air and maybe sanitize it? So UV sanitation and what are the options for those? But then also thinking about the installation and maintenance of those new technologies. So they're great to have, but if it's hard to install or hard to keep up with, it won't work effectively. So thinking too about the installation and maintenance of those. And also, those are some great innovations, but then also what are some short-term solutions to apply to vehicles that could be done in, a weekly time frame and not waiting several months for that. So we also just talked about guidance and how do we make sure that we can have that quickly and effectively communicated to all the agencies. So those were kind of some of our big ideas for innovations.
Great, thanks, Rachel. Appreciate that. We're going to go and now going to ask Paige Pate to tell us a little bit more about what your group was interested in learning about.
Well, we touched on a couple of the same subjects that have previously been mentioned, but some key things that we spent some time focusing on is whether or not systems are implementing barriers between passengers. So not just the bus driver, but also with the passengers and creative ways to think about it outside just the alternative chair. One big area of concentration is this idea of cashless transactions, particularly for those that communities that have a lot of elderly folks, elderly riders. Making sure that they understand the technology and that they are comfortable with the process and how to make it safer for them. Another idea that was touched upon that I think has some great value is whether or not transit systems are offering hazard pay and how to do that in a fair and equitable way throughout their community. One area that we spent some good time talking about was what other practice areas are replicable, meaning what are other maybe like-sized rural communities in other states? What are they doing? And is it really, do we need to reinvent the wheel? Or can we follow some sort of system or protocol that they may have set up and tweak it as appropriate? Another item that was discussed was peer analysis studies, making sure that, what we're doing is smart and what are our peers doing, and kind of a comparison, making sure that they are, we're looking at same size communities, same demographics, that type of thing. And then an item that came up that is not so much about innovation, but just it is worth mentioning is that managing the regulatory challenges during these times as you're going through these innovations. We know that funding is always a concern, but making allowances for being flexible with these regulations. So those are the main items we touched upon.
Great, thanks, Paige.
Mm-hmm.
And I'll take over for our group. Some similar themes around cashless payments and payment options. Interested in learning about some of the different disinfectant technologies that are out there. The systems are using different kinds of technologies, wanting to learn what else is out there that works, what's effective. Air filtration that connects to HVAC was another one. One overall, I think, interesting point that came out is that there's so many sources of information. It's hard to know what works, what's real. So this initiative can provide that one voice, that one source of clear direction when there's so many unknowns, trying to understand what works. So that was one point that came out, I think, that is real important. Interest in learning about social distancing, best practices, maybe a video that could be used to help provide training to employees. Another one is just effective marketing. You know, how can you market during COVID? Some other things, indoor air management and vehicle air management. The last point here is just around how do you keep your staff motivated during COVID? What are some ways to do that? So those are some of the things that the group wanted to learn about. And so with that, we'll turn to the next breakout, which is, I'll turn it over to Morven.
Thanks, Warren. So we talked about wanting to learn more about air filtration on board buses, whether that's treatment systems or just, you know, getting windows that open, vents on the roof of the buses. We're interested in learning more about that. Mobile ticketing, especially with regional coordination, is another area that we'd like to learn more about. The bus of the future, what will that look like? That was a great point one of our group brought up, like Gillig and other manufacturers. What will they be doing to design buses of the future? How will that look? And then again, Warren, similar theme to you. Generally, how do we market it's safe to ride transit again and build rider confidence and getting back on the bus?
Great, thank you, Morgan. So I'd like to ask Shelley Grogg if you can tell us about your group, your urban system.
Hi, everyone. So our group talked a lot. Our group wasn't predominantly urban, actually, but we had a lot of great conversation. Part of it was around technology, and so talking about things like touchless payment, sanitation, ventilation, best protocols for things. But then there was also a lot of conversation that happened around sort of a different take on innovation. So how to be innovative about communications. And so both public communications, educating others, making sure that people understand face masks, and in particular having an empathetic approach to encouraging folks to wear face masks on public transit, as well as how to use signage on buses to let people know what sort of cleaning protocols have been happening, what sorts of safety measures have already been implemented. And then also communication around staff morale and knowing that this is a high stress environment for people who are on the front lines, and wanting to take care of that. And then additionally, there was some discussion around how to just come together as a community of practice, how to have more innovative conversations or innovative collaborations, I guess, with groups that they might not typically work with. For example, one of our group members shared a connection that they had made with emergency management and how they have started exchanging information more than they had in the past and how they found that to be helpful. So generally looking for more ways to stay up to date with each other and other members of their community to organize their work and be as efficient as possible.
Great, thanks, Shelley. Mm-hmm. And we'll go to Greg. Tell us about your group. Greg, you might be on mute.
Hello, can you hear me now?
Yeah.
All right, excellent. We had really great discussions, and I think there's some valuable lessons learned from a couple of systems that would really be helpful to share with others, particularly in the realm of protective shields for drivers. There was an acknowledgement that there are some off-the-shelf protective shields for the larger buses, but that there's still work to do to be able to identify some for smaller buses and even vans. So I think that there's a larger opportunity there. But very similar to what we heard otherwise, you know, cashless fare collection, or even just fare elimination. You know, can we go ahead and do this? The recognition is this is not a short-term issue. This is something that is going to be there for the long run, and you know, eliminating any barriers literally that we can is going to be the best we can do. Thinking about some of the other alternative ways to either you know, prevent contamination or do cleaning. There's talk of using air purifiers, scrubbers, UV light. These would be at facilities as well as in the vehicles themselves. thinking about ways that we can have innovations in sanitizing shelters and benches, whether that be regular or some sort of schedule. And some of that gets at to whether it's the agency's responsibility or working with Public Works, things like that. I think one of the most interesting comments that we received and thing that I hope NCDOT as an organization can look into is creating some sort of stockpile of PPEs or some sort of preference in getting PPEs for transit operators. That there was a really slow rollout and that really didn't help at all. A lot of agencies were left trying to find their own. So if there could be a strategic reserve of these, that would be good. And then also when you start to think about your dial-a-ride, paratransit, or even rural services, recognizing that all of these things we're discussing also have to be applied to vans as well. And that some of the retrofitting on a van could be, certainly more difficult than some of the others. So I mean, I think overall, what I was hearing is basically, how can we continue to provide the level of service that our customers have come to expect, even if it's, some level decreased given the times, with the physical constraints that we're left with, both sizes of our vehicles, number of people who can be on the vehicles due to 6-foot separation, the safety and security of our drivers, things like that. And obviously this all rolls back up into funding.
Great, thanks, Greg. So really appreciate the work of the breakout groups here. And as we begin to wrap up, what I'd like to do is to turn it back over to Jim Westmoreland to close us out.
So thank you all again for participating in the kickoff meeting today. We certainly appreciate the overwhelming response from the systems that we've received. Appreciate all of the good ideas and information that has been shared today. Next slide, please. A couple of things in terms of our follow-up. Again, there's been a lot of information shared both in the surveys today and our breakout groups. We will be following back up with certain systems to get more information around what you're doing in your existing space, and also want some feedback from you about new ideas that are out there. I would say that if you have any new ideas, submit those to Ryan with NCDOT, and we can start developing those and including those with the breakout sheets that we developed today. The other thing I wanted to note was our next meeting, which is scheduled for September the 9th at 9 o'clock. It too will be a virtual meeting. We hope that you all will mark that on your calendars and be able to join in and participate in that as well. I know there was one online comment that I saw from Carol Long about, will the presentation be provided to the systems? And we do indeed plan to find a way to get that to you and probably put it on a repository that we want to create so information can be shared about the project that we're into here, as well as other information around COVID-19. And then last but not least, from my perspective, and since we're running just a few minutes ahead of schedule, if there's any feedback that you would like to offer to us relative to the meeting today, let us know what worked well, what might need to be improved in the future. Again, if you could provide those comments to Ryan, we would appreciate that. I think everybody should have his email. If not, we'll send out an email, ask him to send out an email after this in terms of a copy of the presentation and any additional follow-up, and you'll have it then. And then finally, last but not least, I did want to again thank FTA Administrator Dr. Taylor for joining us this morning, Julie for her leadership in pulling this initiative together, Chief Deputy David Howard for joining in and providing his support, and then most importantly to each one of you. We know this is an extraordinary time for the transit systems in North Carolina. I know from being in Greensboro, having the responsibilities of running the transit system at one point in time and sort of being in contact with some of our local folks here, there's many things that are going on that were never imagined 4 months ago that we're all having to deal with now. The key to success going forward is going to be how we partner together, work together, promote and share information. And then as we move forward in sharing these ideas, I think it's going to be really something that will benefit hopefully all of us, and we know that together we can make a difference. So with that, I will say thank you again very much for your time and participation today. We hope you found the meeting both engaging and that you've learned something from being involved with us. And we'll look forward to seeing you then on September the 9th at 9 o'clock in the morning. So with that, thank you, everybody. Be well and have a great day. And we will see you on September the 9th. Thank you.